Good afternoon, ladies and gentlemen. I am indeed privileged to be here facing this august gathering, and I would personally thank Amity to be invite me here. I would thank Dr. Ashok Chauhan, Dr. Gurinder, who have selected such a powerful theme for today. It's indeed a pleasure to be working on this theme. And before I can commence anything else, as Dr. Chauhan said just now, I am also Amityan in a way that it was my choice, decision for me when my daughter was going for her graduation. Well, she wanted to do BBA, and the first recall that came on my mind was Amity. She's today a proud Amityan in the third year, and she also is taking the international program, which is an exchange program in UK, and I am willingly sponsoring her to go there. So that's my connect with Amity, and I shall always be there. Before I move any forward, let me just show you a few innovations that have happened. Well, no ice chest, that's an innovation. Don't be scared. Seat belt broken, no problem, innovate. No bottle opener. Your beer would still open. Do not worry about your car stereo stolen. How many of us cannot afford a GPS? Double it up with a cell phone. That's cooperation, that's partnership. You cannot see an ATM screen. Well, there are ways to do it. You imported a car from US, you want to drive on the roads here. Let your satellite not work when it's raining. Innovate. For all the mothers, feeding and laundry can go together. And if you have run out of diapers, innovate again. Right. Okay. Ladies and gentlemen, I today represent I'm coming from the healthcare industry. My past takes me to the services. I have now come to the healthcare. They both have something very much in common. Well, if we have moved from daggers to nuclear warfare, even medicine has moved from herbal medicine to nuclear medicine. Well, in all this journey from herbal and daggers to nuclear, a lot of innovation has gone through, a lot of work has gone through, a lot of ideas have gone through, a lot of integration has taken place, a lot of inspirations have taken place. For today's theme, nothing better, I can think of nothing better insofar as inspirations, insofar as innovations, insofar as involving is concerned, is the real example of healthcare. And Fortis was one such company which innovated healthcare, which moved from the charitable hospitals, which moved from the trust hospitals, which moved from the government hospitals, and did a healthcare delivery in a very different form. Just a few lines about Fortis, set up in 1996 by then owners of Ranbaxy. The aim was to create an end-to-end healthcare organization with capabilities in drug research, clinical drugs, healthcare, and laboratory services. The first hospital was set up in Mohali, which had one of the highest per capita income, and the company started with no fixed organization structures or personnel policies. All the hospital wanted to promise was something like Amity to deliver world-class education. This hospital promised a world-class quality of care, saving people a 250-kilometer trip to Delhi, a network of 48 hospitals today, and this 48 has not been easy without innovating, without evolving each day. What was boiling in the cauldron? As I said, we as a country were used to trust charitable government hospitals care. Well, Apollo had come in a little earlier, but yet the mindset of the bulk of Indian was a charitable trust government hospital. When Fortis came in to introduce managed care, there was a great resistance. There was a resistance not from outside, there was a resistance from within. The healthcare professionals were not used to it. The healthcare professionals, the doctors, they felt differently. The doctors did not want to be managed by non-medicos. The doctors did not want to be managed to be asked to meet deadlines. When I say deadlines, I mean deadlines of occupying hospital space, deadlines of treating patients. When I repeat the word deadlines, not deadlines as in that you got to hurry up, but then yes, even if you have to work late and a patient has to be given care, then he must. A doctor was not used to punching in. Imagine any one of you sitting here asking a senior cardiologist, a senior radiologist, a senior nephrologist, sir, when you come in, but sir, there are some rules that you need to punch in. Well, there was great resistance. We often heard, I have been in the industry for quite some time now, we often heard initially F&B and room services in hotels. Sir, hospitals have canteens. Do not bring F&B here, we are not hotels. People are here for treatment and not vacation. Often heard, we believe in patients, we don't believe in guests. Yes, we believe in patients, and sir, but if we can innovate, we can integrate, we can combine this care with a little more hospitality, what would go wrong? Get the front office staff and the guest relation officers out of here. So we are used to receptions, we are used to technicians. There are no concept of front office staff and guest relation officers. And a big U and I. A U was non-medicos, a U was non-healthcare professionals, and an I was we, the medical professionals. Well, that was the boil, that was the cauldron. I would now get on to how we handled this. I've named this slide I4. As we all know, the theme for today is I4, innovating, involving, inspiring, integrating individuals. And we also heard of imagination today with Larsen and Toubro. We did simple things. We innovated simple things. Checklists were evolved. If any one of you have seen checklists, the pilots do it every day. They've been doing for years. They've been doing for decades. They take off and they land safely because they have checklists. They check their altimeter. They check their fuel. They check their emergency procedures. They check their emergency doors, and that's how they take off. A simple checklist to tell a doctor, sir, you got to wash your hands before you touch a patient. You got to be in scrubs, and when you are in scrubs, well, we shall not allow you to be out. We won't use the hard word, but you shall not be allowed. But sir, our checklist says that every time you walk out of the scrubs, please, when you get inside the OT again, change your scrubs. A few checklists evolved. Resistance, yes, there was to this managed care. It happened. I'm using this story. I am taking you through this history to know that, well, when we are innovating, we are also integrating, we are also inspiring, and healthcare was one such field which was not such an easy area. Behavioral economics. Well, we are not always right. We do not always react well. If we were such big disciplinarians, when we would take our medicines on time and when we would probably rinse our teeth at night, the doctor would not have a problem. So this management person, this manager, this managed care guy went to the doctor. He says, sir, we shall prod the patient, we shall remind him, we shall have a happy heart day, we shall have a nephrology day, we shall have a urology day, we will have a preventive health checkup, we will remind a person when he has to go for a next checkup. You don't bother about it. You be involved in clinical care. Well, this was the behavioral economics. So we will help you with patient portals. We will. Can any one of you would have imagined that you always needed a lab report to go to a doctor to be checking it? All right. I'll continue from here. I just saw a lot of distraction. So anyways, so get back. So I was just taking you all to through a very different area of medical care. Patient portals today have evolved. We today log on to websites, we see the reports, we see the ranges, we manage our own reports ourselves. Payment innovations, two difficult things to innovate. Well, on one hand was complacency of a fixed salary to get a person complacent, and yet if you put somebody on variable, well, when money changes hands, perverse things also happen. A very difficult task to achieve, and that's something very difficult. In fact, why I would say even a very difficult task to achieve for someone, for a setting of healthcare, for a setting of hospital to accept an HR like me is itself a difficult job. My dear sir, how do you decide who's a capable surgeon? My dear sir, you would not know what a PTC or what a CABG stands for. Leave the laparoscopies to me. Well, that was past. As we moved on, we sit down, and I guess we are at a stage where we discuss mortality and morbidity rates. We talk of infection control. We talk of nothing is done in isolation, because all this happens along with your clinician. But an acceptance has come today that yes, managed care also means that this HR professional can lead healthcare too. Evidence-based decision making. It's like your car. You go to an auto. Go for a service, you feed in your number, you get the records. That's what we're giving today to the patients, that you go to the hospital, and doctors also made evidence-based decision making. He's using tools of the computer. Accountable care organizations. All the healthcare organizations are meant to treat patients when they're sick. Can we innovate? That's why I've written bold, can we innovate to keep you healthy out of the hospital? Well, that's what innovation is all about. Why should we worry only about treating the sick? Why should not we evolve and innovate ways where we can keep you healthy and keep you out of the hospitals? We all Skype from here to San Francisco. Virtual visits are soon going to be a reality. We're already onto it. We are doing telemedicines with various villages. We are addressing the rural people through telemedicines. A day is not far where you shall a day is not far when you shall also be visiting your doctor on the computer or the TV screen and taking diagnosis from that. We're talking of stem cell therapies. We're talking of regenerative medicines. Most of it has been achieved. We are doing it. My question here is not, or my pitch here today is not to talk of what we have innovated. That was just to orient you. My pitch today is how to go forward, what are the future needs, what are the future innovations, how do we address this healthcare in future. And if I talk of healthcare, I'm sure all people, all other industry captains who look into their own industries will also have something to think that what can they innovate in their organizations. Are we overshooting healthcare delivery? While I represent a big healthcare delivery chain here, a big healthcare delivery group here, let us ask this question, because this forum, are we overshooting healthcare delivery? Will this take us forward? Medical colleges have given us specialists with extraordinary capabilities, but did very little on how to provide healthcare in a simple and more convenient way. The dominant players are only chasing sustaining innovations. What I mean by sustaining innovations, high-end technology, fancy technology. You're talking of big Tesla machines, 164-bit, 64-bit, 128-bit imaging machines. Will that sustain, or is that aimed for the high-end profit-making customer? What about bottom of the pyramid? What about disruptive innovation? Because all this gives a raise to the startup companies who would now come out with simple, efficient, less complex technologies which are more customer friendly. Something when you talk of a mainframe, many of us have read or even experienced that good old days, somebody would wait outside a mainframe room with a chit, waiting in a queue to go inside, do your computing and come back till the IBMs were taken over by Microsofts and Intels when they gave you these laptops and desktops. Well, that is what we are looking for. I've been handed over a chit that there is a paucity of time. I'll rush with it. Managers need to focus to enable less expensive professional do more expensive things in a less expensive settings. Well, that is my theme for today. That is my theme when I talk of disruptive innovations. Simple question, can we sustain highly trained physicians to down-market themselves and be treating ear infections? Have you ever thought that today the days are gone when a diabetic would need to every time go to the hospital and get his urine sample to be managing diabetes? I'm sure a diabetic today carries a glucometer in his pocket and is managing his own disease himself. So would you need a high-end physician to treat your ear infections? Would you have a person going to an ophthalmologist and asking him, sir, we have a family history of everybody wearing specs at 7 years of age. I have my son who's only 4. Can you alter his genes? Can you do something to his genes? Can you do some stem cell therapy? Insofar as eye flu is concerned, I've seen it on the net. I've seen what medicine to give if symptoms look alike. I think we'll go for that. But I need bigger advice from you. Create and embrace a system where clinician skill levels is matched to the difficulty of medical problems. They all mean the same. Move from a pattern recognition to a solving mode. Physicians need to embrace this change and not resist it. Invest less money in high-end complex technologies and more in technologies that simplify complex processes. I would end with one of the sayings from Xerox brand Rally Rand. As I said, everybody should keep evolving, encourage everyone's evolution. Moment you do not encourage evolution, you want to have yes men around you, then as Barry Rand said, he had warned his people that if you have a yes man working for you, then one of you is redundant. Thank you very much.